me what brings you in today.
Actually, I've started having a bunch of brown spots on my face for the last, I want to say they started maybe about 4 years ago, and they've gradually gotten worse. So just want to know what they are, what I can do to get rid of them.
Sure. So you have a typical presentation for what's known as melasma. Melasma can come up during pregnancy, but it's not always due to pregnancy. It can also come up due to birth control pills, but again, we also see it in patients who've never been on birth control pills, never been pregnant, and we also see it in men. It's kind of a hyperreactivity of the cells that are producing too much brown color, but there's several things that we can do for you here to improve it. Number one, there are brightening agents that you can put on your skin at home on a nightly basis that can help to alleviate some of the discoloration. But it's critical that you use them in combination with a sunscreen that contains zinc oxide and also with a tint. The reason being is that UVA rays help to cause this melasma. UVA rays are tricky in that they come through window glass and they come through clouds. And so they're out there all the time, and in Chicago we have them all winter long as well. So it's very critical that you wear sunscreen every single day, and if you're outdoors you do need to reapply that sunscreen every 90 minutes or after swimming or sweating. But the good news is we've got a lot of different sunscreens that can be put on, and there's also some powdered sunscreens that you can put on top of makeup if you need to. There are also treatments that we can do to help alleviate the melasma. These include things as simple as silk peel microdermabrasions with a brightening fluid that helps to exfoliate the skin and lighten the brown spots, to PCA peels, which also contain medications to exfoliate the skin and calm down those cells that are overproducing the brown spots. We also have a laser known as the Fraxel 1927 laser, which can help to lighten up melasma in some cases. Do you have any questions?
How long does it take to actually start seeing any results?
Very good question. So your skin takes about a month to cycle to kind of go from the bottom layer up to the top layer and flake off. So whenever we're using creams, we're looking at 3 to 6 months of treatment before we see a noticeable difference, just because we've got to go through those skin cycling processes. If we add on the silk peel microdermabrasions or the chemical peels or the Fraxel treatment, it will go a lot faster.
And once I start on a regimen, is that something that I'm going to have to continue doing the rest of my life?
You will definitely need to use sunscreen for the rest of your life, because melasma likes to come back. If your skin sees that UVA rays, it'll actually start to trigger more production of the melanin, which is the brown stuff that we're seeing. So you really do have to be sun protective for the rest of your life, and you might have to use some creams during the summertime. But other than that, we hope to try to make it calm down for you so it doesn't show up as much.
Okay, great.
We'd like to get you brighter, clearer skin if we can.
Yes, absolutely.